can't say enough how good sunglasses are
Yeah.
from a preventative measure. If you've got an irritated red eye, ideally you get it checked, particularly if it's not responding to something like a lubricant. And if you've got a raging red eye with light sensitivity, then you need to be seen as a matter of urgency. So thankfully they're rare, but it's nice to just have people understand that you don't hang around for those things. Go and get it checked. Don't wait for it to go away. It's not like a spot on your arm. We're talking about your eyes, the most precious sense.
If you live on the Gold Coast, especially if you're out in the sun a lot, whether you're surfing, on the tools, or just enjoying the lifestyle, chances are that you've dealt with irritated eyes at some point. Maybe they feel gritty after a long day beside the water, or you're getting that red, itchy sensation and not sure if it's allergies, dry eye, or something more serious. Well, today I'm joined again by Paul Graham, lead optometrist and owner of Harmony Vision Care in Varsity Lakes, and we're breaking down some of the most common causes of irritated eyes, what symptoms to watch for, and what treatments actually work. We'll be covering everything from so-called surfer's eye to contact lens discomfort, allergies, and even cataracts, and how all of these can affect your vision and eye comfort. But first, who am I? My name's Paul Salloway. I'm the owner of Optics Digital Marketing. We're an agency that helps independent eye care practitioners to grow their clinic. So, hi, Paul. Good to see you again.
Hello. Yeah, good to see you again, Paul.
So, I know you're on the Gold Coast there, and a lot of people, present company included, are probably a little bit green with envy of all the outdoor opportunities that affords you, the sun and the surf and so on. So, but of course, the high UV environments like Australia's beaches and sand and wind and what have you also present eye challenges for a lot of people too, don't they?
Oh, absolutely. And I just reminded me that I remember being in France in May last year, and a 26-degree day, the UV index was like 3 or 4, and the similar day here would be, up in the 10, 11, 12, 13 kind of category. And so, yeah,
Right.
we certainly have a high UV exposure here.
Right. Are you a surfer yourself? Do you have do you spend a lot of time at the beach?
Not as much as I used to, but I did spend a lot of time on what they call a goat boater. So
What's that?
I'm on a surf ski or a
Oh,
wave
okay.
ski.
Okay.
Yeah. So, yes, despite many attempts, my ability to surf didn't come to fruition, but I'd always been a paddler. So I took that up. So, yeah, there was probably a good 2 or 3 years there where I was out probably at least 3 times a week, rain, hail, shine, winter, summer. So I was a very keen paddler.
Yeah. Well, a lot of people who are out in the sun and people who are exposed to quite a lot of UV may notice a small bump or a patch starting to grow on the white part of their eye and worry about it. So what is it when you see that kind of thing develop, and can you sort of like explain to us like what causes that?
Yeah, look, the cause is easy. It just boils down to UV exposure, and then you two sort of main ones that you encounter is either a pinguicula or a pterygium, and they both sort of start in the same location, but one's a bit more sort of an aggressive growth compared to the other one. Those two particular types aren't a cancerous growth; it's more a thickening of the tissue in response to UV. It's interesting that it appears typically on the nasal side. And you kind of think that you get some sort of blockage from your nose to that side, and UV would normally come the other way. But so there were some theories about a little bit of reflection off your nose into that area. But the real understanding now, from an optics point of view, is that the cornea on the front of your eye is a very powerful lens, and so we bring out the old famous lens model here. If you flip it around that way, so light entering here gets focused over to there, and so it gets intensified. So it actually almost comes in the tissue underneath, and that's the sort of theory behind pterygium growth and why we get them on the nose side. So it's related to that amplification of the UV through the cornea. A pinguicula is kind of just a yellow thickening. Some people have them for years, and it's not until their eye gets a bit irritated that they start to go, oh, these lumps have been there, and it's like, well, I suspect they've been there for some time, but it's just a little bit of redness around it kind of tends to highlight it. Whereas a pterygium is a growth that then starts to grow into the cornea, and if it grows big enough, it can start to degrade your vision. And so they're the ones that we're probably a little bit more concerned about.
Yeah. So pterygiums and pinguiculars, they're always fun words to say and even more fun to spell. So just to clarify that, so which one is the actual growth and which one is just a yellow spot?
Yeah, so yellow spot, pinguicular, growth, pterygium. And people can confuse pterygiums with cataracts. And so a cataract is something that occurs from, again, it can be a UV damage accumulation over the years, but a cataract is something you get inside the eye, inside the lens itself. So cataract tends to be this part here, okay, whereas pterygiums, pinguicular, are on the conjunctiva next to the cornea, whereas a pterygium starts to grow in. And you can see here we've got the pupil. So if the pterygium grows in far enough, it starts to distort the light entering the pupil, and that's where you can get this sort of irregular astigmatism and blur, other than just the aggravation too of it getting red and sore.
And I think aside from vision problems, like maybe some people, they feel uncomfortable about the aesthetics of pterygiums and pinguicula. So I guess one, like how can we prevent them, and two, like what options are there for actually removing them?
Yeah, look, sun protection from an early age, particularly as we were talking, sort of the high UV. If you're living high altitude, snow, or near water and beach, you get another 25 to 30%, and possibly more in some conditions, of UV reflected from the surfaces. So you're getting an additional dose. And that's the thing with being on the east coast of Australia. You're looking out into the sun while you're surfing in the morning, and so you're getting the UV directly in. So wearing some, I know it may not be so cool, but wearing some sort of UV protection in those conditions is a good idea, so that you're sort of blocking that, and something that wraps really well, so you're actually sort of blocking the light from the side in particular. As far as sort of, I'm not sure how much research has been done on just whether lubricating it changes how much it grows, but certainly using lubricants to keep the eye more comfortable, because you've got this bump sticking out and the tear film kind of runs off the top of it. They tend to dry out and go red, and so cosmetically you can get some improvements on small pinguicular and small pterygium just by using some lubricant. Often the redness goes away because you've covered the eye up, it's no longer dry, and so you don't get that vascular response anymore. So lubricants is always a great idea for those sorts of things. And then if you're prone to sort of eye allergies, then we'll get into that discussion in a moment. That may also help just kind of decrease the redness. But I would always go for a lubricant first, because lubricants are usually, you can't do a lot of harm with a preservative-free over-the-counter lubricant most of the time. Yeah, the pinguicular, not a lot tends to be done about those. Pterygiums traditionally only were removed when they became sight-threatening. So the classic measurement was when it was sort of halfway to the edge of the pupil from the edge of the eye, or the edge of the cornea. That's when you went and got it done. But the old methods from decades ago meant that there was a very high chance of that pterygium regrowing, and so there was a lot of putting off and getting that sort of surgery done because of that. But the new techniques now have almost sort of tipped that regrowth rate on its head. So they're tending to be more comfortable operating on them earlier. And certainly there's plenty of examples of them being done if cosmetically it's an issue. So speaking with a surgeon, when they said they're often getting models who are getting it done because it's part of their career profession. And the other time we see it, if someone's got a really red aggravated pterygium and lubricants just aren't doing the job, then that's when they may consider doing an operation to remove it.
Right. Okay. Well, you mentioned about red eyes. So a lot of people, I think most people at some point have red eyes, itchy eyes, watery eyes, and I guess that those symptoms and the causes of them can overlap quite a bit. So, like, how do you distinguish between things like allergic conjunctivitis, dry eye, and other types of conjunctivitis for that matter?
Yeah, look, and I guess that's the important point too, is that, getting any sort of red, watery, sore eye, really having it professionally checked is the best way to sort of diagnose it. But typically we're looking at, there are three types of conjunctivitis. So conjunctivitis is an inflammation of the conjunctiva, and the conjunctiva is the clear tissue that covers the white of the eye and the inside of the eyelids. And so you can have a viral conjunctivitis. We don't tend to see those as often as the other two. And that tends to be a red, watery eye. Sometimes you get some light sensitivity. And again, if you've got any red eye with light sensitivity, you need to be getting that checked by an optometrist or at the local hospital. That's something to take very seriously, any redness and light sensitivity. So viral tends to be a watery eye. Sometimes when we look inside the eyelids, we can see these little lumps called follicles. And that's a bit of a telltale sign that you've got a viral conjunctivitis. Viral conjunctivitis is quite contagious, so we really need to be careful around hygiene, hand washing, and if your partner's sharing the bed, you've got to probably spend a couple of weeks away because of how contagious viral conjunctivitis can be. I think most people are familiar with bacterial conjunctivitis, and that's when you get that red, meaty, really kind of mucky, eyelash stuck together, goopy kind of thing. And managed with some, in Australia, depending on your age, and you can often get an over-the-counter antibiotic for that. And so they're fairly typically easy to see because they're pretty gunky and messy. Then you have allergic conjunctivitis. Now, we were taught that you're looking for, so number one, itchy eyes. Some of the signs you might see, sometimes it can be confused with an early bacterial conjunctivitis. They can be red. There's a certain type of lump that we look for in both of those. If there is mucus, they talk about a stringy white mucus being present in the eye. And again, you can have some allergic conjunctivitis can be quite tricky to sort of pick up because sometimes the signs aren't always obvious. It's, itch might be the main symptom. And, there are cases where it's likely related to the person having hay fever and other kind of general allergies as well. But, itch is probably the number one thing. And then sort of added all into the mix there is the irritation you get from dry eye. And dry eye is very, very common now, particularly a form called evaporative dry eye, where our tear film's unstable, evaporates very quickly, typically because of a lack of oil in the tear film.
And if somebody does have allergic dry eye, they're probably, they're tempted to do a lot of eye rubbing, which, as we've talked about before, I believe is problematic, isn't it? So it's something that, especially if you've got kids who are doing a lot of eye rubbing, it's something that you need to get checked pretty quickly, right?
Absolutely, and you really need to avoid eye rubbing. One, it doesn't really help the situation; it kind of exacerbates it. But there are conditions that are believed to be caused, or if not accelerated, by eye rubbing. Things like keratoconus, where you actually start to misshape in the front of your cornea, and that becomes a much bigger issue. So someone who's got a lot of allergies and itchy eyes really needs to sit on their hands. Absolutely no eye rubbing.
Well, so a lot of people love contact lenses, and I wore contact lenses for a while. I definitely enjoyed them, but some people complain about irritation at the end of the day also. So what are the top causes of contact lens discomfort, and how do you approach fixing something like that?
Yeah, so some of them can be that you might be someone who we might consider to be a case of borderline dry eye. So in a situation without contact lenses in, you don't really notice your eyes too much, and then a contact lens requires a bit more out of your tear film, and so you tip from being asymptomatic to symptomatic, and so that may be that we need to be managing a dry eye situation. For some people, it might be just as simple as using some lubricants with their contact lens to when they're getting symptomatic, but then if you're finding that you're not getting relief from the contact lens, I mean, we always sort of say with contact lens, where if in doubt, take them out if you've got sort of ongoing discomfort. It's easier to assume it's dry eye. You don't want it to be an early infection, but the main thing is if you're finding lubricating your eye with the lens in helps, then that's a fine way of sort of managing it. It can be just environmental reasons. A good part of dry eye symptoms in general, whether you're wearing contact lenses or not, is not blinking enough. And so when we're concentrating, so long drives, working on the computer, reading, doing anything that requires us to concentrate. We don't blink as often, and so therefore you're not re-wetting the front surface of the eye or the front surface of the contact lens. And we tend to do incomplete blinks as well. So part of that, we're not wanting to interrupt the flow of information, and we do these little half blinks where the bottom half of the eye and the lens dry out because we're not getting that complete sort of closure. So we do talk about, moments of mindful blinking, taking breaks to make sure that your eyelids are actually meeting. It doesn't need to be a squeeze, just needs to be that the eyelids touch. So that can be one way of managing it. Other forms of irritation with contact lenses can be from protein buildup. So, and we have proteins in our tears, and they can bind and stick to the front of the contact lens, and different lens materials and different people might deposit it at different rates. And that builds up over time. So if you're wearing a lens that is a reusable lens, so if you've got a soft lens in as an example, that you might take it out every night, but you get to wear it 14 times or 30 times before you dispose of it, then you can get an accumulation of protein from day to day. And so that becomes very important to make sure you're rubbing that lens, because that can create irritation and discomfort. And if you put up with it for too long, you do get people who build up an allergic reaction to their own proteins on the lens, and contact lens wear becomes a lot more difficult for them. One of the ways we get around that is using what we call single-use or daily lenses, because you're really disposing of them before that protein gets a chance to sort of build up on the lens. Yep. So we typically look at daily lenses having some of the lowest complication rates around. So our preference is, if, regardless of whether you're a part-time wearer or someone who wears lenses every day, daily lenses can be a really good choice if they're available in your prescription. To help manage that. And then you've got different materials. So some people find there are certain types of materials that they just don't find as comfortable. It could be the design of the lens itself. Does it have any sort of wettability coatings? It's the edge design. And so that becomes part of the art of fitting contact lenses, is knowing that you may need to simply just try a different brand or a different profile in order to get some improved comfort.
I have heard of extended wear contact lenses where you put them in and leave them in for days, or if not longer. Is that something that you still provide patients? And why would a patient go that route rather than putting something fresh in their eye every day?
Look, it can be seen as a bit of convenience. Most people learn how to take a lens in and out. They might not like the process, and so want to avoid having to sort of do that. There are generally some cases who just find contact lens handling a little bit more challenging, so leaving a lens in can be an advantage. I'm sure there's certain lifestyle choices where not having to take the lens out is sort of a benefit. The challenge we've got is that your risk of an eye infection is much greater with extended wear. So it was a big, probably, that when they brought the new generation materials out, it was touted as being this thing that was going to change extended wear, but the reality is it didn't really decrease those infections related to extended wear as much as I was sort of hoping. So we tend to track it very carefully, and everyone's different. You'll get some people who seem to manage it just fine, and others it becomes a much more risky thing. And you're dealing with infections. If you get a bacteria that kind of gets underneath the lens, some of them can permanently damage your sight. And thankfully they're quite rare, but the risk does multiply up if you're doing extended wear. So we don't tend to do it all that often now.
Okay, so for patients who can't tolerate traditional contacts, and I'm talking about soft contacts and even RGP lenses, rigid gas permeable, although I guess they're not as common as they used to be. Are there any alternatives available now? Like, I guess things like ortho-K, scleral lenses. Like, would they be better options, you think, for someone who has sensitive eyes?
Yeah, look, we if we sort of tick off the box on scleral lenses, yes, look, that's something that is sometimes potentially used in someone who's got quite severe dry eye to try and protect the cornea, and you're holding a body of liquid against that. Scleral lenses we might use occasionally in someone who's in a really dusty environment, or wants something that's sort of really super stable. But we've got to be a little careful with oxygen with scleral lenses. If you're talking, the average person with short-sightedness and maybe a little bit of astigmatism and small amounts of long-sightedness now as well, we can do ortho-K, which is the overnight lens. I think we've discussed before. It's one of those lenses that sounds a bit too good to be true, even though it's real. The concept has been around for probably 60 years now, and it's probably been 30 years in actually being used in the modern form. But effectively, that is a rigid lens that you put on before you go to sleep, and it gently reshapes your cornea. And it's a temporary thing. It's a bit like how clothes and jewelry can leave a little indent on your skin. Cornea is and so we use a specially made back surface on a contact lens to leave an imprint. And as I said earlier, the cornea is a great big lens, so it only need to change the shape of it a little bit to be able to correct your vision in many cases. So yes, and the advantage then is that you've put the lens in, reshapes your eye, you wake up, you take the lens out, you can see clearly. You don't have a lens on, so any of those contact lens related irritations and dry eye are minimized in that format.
I'm in some in a Facebook group for scleral lens wearers. Not that I wear sclerals, but I'm interested to hear what people's experience is with them. And what I hear from some people is their eyes, they might be dealing with eyes that have undergone some sort of trauma, or maybe like in the old days, they had some kind of invasive procedure that didn't go so well. So a lot of those type of people still have very sensitive eyes. So do you think sclerals would be a good option then for that type of patient as well?
The biggest use of scleral lenses is someone's got a highly irregular cornea that you just can't sort of get comfortable or clear vision any other way, because you're providing this nice big sort of consistent surface for the light to hit first, because you've covered up the irregular cornea. So we do a fair bit of fitting of scleral lenses in this practice. You've got keratoconus, you've got post-graft patients, you've got certainly injury. We don't tend to see as many of them now, but in the early days of some laser surgery, some people used to get an ectasia after the laser surgery. But I think they've learnt to rule out those higher risk cases. So I've seen one recently, but that's typically less often, at least in my part of the world. And like I said, I've fitted a few people who have had significant dry eye where it's almost like a bandage. It helps protect the eye from dryness.
Okay. You mentioned before about cataracts and pterygiums, and how the like people who are experiencing either of those may feel that like their vision it isn't as good as it could be. So like what should people be doing to rule out one or the other, and like what can they do if they are experiencing some kind of like blur in their visual abilities?
Yeah, well, and that forms a good part of a regular eye exam is looking at anterior eye health and then posterior eye health or internal eye health, and making sure that if you are starting to have blurry vision, getting a measurement of what that vision is. Are we able to recover the vision or restore it by putting glasses or lenses in place? If you're not getting good vision restoration with lenses in place, well, then we need to start going, okay, is there something anatomically wrong? Is it some sort of distortion in the cornea? Do you have a cloudy lens? So again, if we go back to the eye model, that's the crystalline lens in the eye. It's typically clear, but it starts to go cloudy. I mean, that's an exaggerated one, obviously, but we want to have a look and see if that cloudiness is the cause of your reduced vision, or do you have something going on at the retinal level that might mean the actual reception of the light is the issue. So we kind of need to work out where your vision loss is from, and then if it's a cataract, then the decision is it something we watch and monitor, or is it something where we might get the opinion of an eye specialist with the view to having the cataract removed and having an artificial lens put in place. Probably a similar thing with pterygium, and again, cataract is an internal eye problem, pterygium is an anterior eye problem. And with pterygiums, we've got lots of different methods of taking images. So if I've got someone with a pterygium, I'll take a photo of it. And that way we try and get a sense of how big it is. And so if it's one of those things where we're kind of going, okay, look, we're managing the aggravation with some lubricants, and we just want to watch whether it's progressing or not, take a photo, check them again in some months' time, and we'll work that out on a case-by-case basis. I'll also do what we call a topography. And so that's taking a shape map of the front of the eye to see how much of the cornea might be being distorted. So you might have a pterygium that's just in here, but the distortion might be just in front of it, and it's not something we can necessarily easily pick up. Whereas if we take a map of the cornea, we can kind of start to see if that distortion's starting to kind of get towards the pupil. And then it's a matter of, okay, well, if it's aggravated and it's starting to threaten good quality vision, then again we make a referral to an eye specialist to have that considered and have their opinion.
All right. Well, this has all been great information as per usual, Paul. So I guess one of the takeaways from all of this, I suppose, is that regular eye checks really pay off, don't they?
Absolutely. We've got a lot of it is preventative medicine. Just making sure everything's looking good, having a record of what it did look like on this date, and so if it changes, we can sort of refer back. Absolutely.
All right. Anything else you want to add before we wrap up?
No, I think just to sum up, sunglasses are a great thing. So, wraparound sunglass protects you from UV. It cuts down the breeze. It creates some humidity in front of your eye. So you're protecting yourself from pinguecular. You're reducing your risk of cataract. You're reducing your risk of pterygiums. You're reducing dry eye symptoms. And so, you can't say enough how good sunglasses are from a preventative measure. If you've got an irritated red eye, ideally you get it checked, particularly if it's not responding to something like a lubricant. And if you've got a raging red eye with light sensitivity, then you need to be seen as a matter of urgency. So thankfully they're rare, but it's nice to just have people understand that you don't hang around for those things. Go and get it checked. Don't wait for it to go away. It's not like a spot on your arm. We're talking about your eyes, the most precious sense.
Absolutely. All right. Well, can you remind people how to get in touch with you at Harmony Vision Care?
Yeah, so harmonyvisioncare.com.au is our website. We have a Facebook page, and with the website you can ask questions, book appointments. It's got our phone number there. Our phone number is 0755205900.
All right. And don't forget to hit the like button and subscribe to the YouTube channel if you want to be notified when Paul releases more of these YouTube videos. And also, please follow Paul's Facebook business page and Instagram to see him post updates on the latest news, promotions, and events at the Varsity Lakes practice. All right, so I think let's finish there for today. So thanks a lot, Paul, and until next month, have a great day, everyone. Bye-bye.